we're going to talk about mid-session calf wrap management here. So this would be used in the case where the calf wrap has either visually slid down to a position that you're not liking, or the app itself is actually giving you a warning or an error telling you that the calf wrap drift has occurred. So in this scenario, what you're going to want to do with the patient is, first off, end and save your session. So that will save any data that you've collected to this point for the session. Next up, what we're going to do is keep all the hardware in place, but we're going to remove the calf wrap from the patient. And this can be done either standing or seated, whatever is more comfortable and appropriate for the patient. So I've undone both buckles. What I'm going to do next is start from the medial side here and grab the Velcros of that front panel. I'm going to take that off. And I'm just going to unvelcro the whole rest of the calf wrap from the calf wrap liner. Again, not removing or touching really any of the hardware. Now that I have that off, I have my calf wrap liner exposed and I can do whatever I like. I can use the calf wrap Velcro to create a space in there for my fingers, where I can then roll down to expose that light gray. Okay. I can come down, let the patient's skin dry off if they've gotten a little sweaty or anything, pat them down, dry off, give them a break. And then we're just gonna move that liner right back up to where we want it. We're gonna come away from the skin as we're donning that liner. We're gonna take our calf wrap and just get it right back into place. So we're gonna come around. I'm gonna find that other panel here. I'm gonna lay that side, get that bottom panel down. And then lastly, the front panel is going to come across. Get him midline, my 4 Velcro tabs. Okay, so we're going to redo our top compression buckles. Make sure we're clipping them back down. And then just rechecking our boa just to make sure that our tightness there is where we want it. So our calf wrap is back in a great position. What we will need to do next is come back and start a new session. So we're going to need to find a new pre-tension position. Without doing that, the next time we go to use the device, it would have remembered its previous pre-tension position and wouldn't have applied the correct forces. So calf wrap is up higher, pre-tension is complete, and we can re-begin our work.